Hi, my name is Jodi Herrera, and today we're going to talk about SMI, which is severe mental illness, PTSD, and cancer. According to Serene, Cox, Stein, Afifi, Fleet, and Asmundsen, PTSD and severe mental illness individuals who develop cancer may not be able to cope with their lives. Furthermore, SMI cancer patients may have had an involuntary intervention earlier in their lives with a psychiatric hospital where they were constrained that led to PTSD, and now they have to deal with being in a hospital for cancer. Additionally, cancer patients can develop PTSD while being evaluated for this life-threatening disease. Questions. Imagine if you were that person who suffers with SMI, been through an involuntary intervention for a serious SMI of being constrained to a hospital bed, suffer from PTSD, and found out that you have leukemia. How do you think that you would personally cope with that situation? Next question. Now, you're the social worker. How would you meet the client where he or she is when he or she is in the hospital bed at a cancer institution? What interventions could be helpful? Trauma exposure. Trauma can be experienced through rape, domestic violence, death of a loved one, disasters, life-threatening diseases such as cancer, or warfare. SMI patients are more likely to have a higher tendency to experience trauma, and this leads to increased likelihood of PTSD in SMI individuals. Symptoms of PTSD: reoccurring nightmares, flashbacks, avoidance of thinking or remembering trauma, irritability and disregard, hyper-awareness, difficulty with concentration, alienation from others, numbness of feelings, difficulties falling asleep or waking up, psychological and physiological fear. PTSD for the SMI cancer patient. The most prominent SMI is a major depressive disorder. They experience apprehension, anxiety, and powerlessness. There's a fear of cancer reoccurrence, bad dreams about cancer and treatments, animosity, frustration towards loved ones, avoidance coping, substance abuse, and negative role performance. They may not be able to bear financial stressors, occupational changes, feel alone, and have problems with intimacy with a partner. Further, they lose positive self-image, vigor, and morale. SMI cancer patients have a higher mortality rate than their non-SMI counterparts. Cancer is reoccurring trauma that can affect a person for a lifetime, which can lead to chronic PTSD. Survivors that have experienced cancer in childhood are more susceptible to PTSD due to reoccurrence of cancer and other physical ailments. Trauma-informed care. It's for safety, working with the patient to ensure that they feel safe in their environment. For example, obviously we would have constraints, but maybe all the wires and tubes that we have on, maybe we can give medication orally. Trust, that's something that has to be built between everyone in the hospital that works with the patient. Collaborate on the treatments that the patient would need. Empowerment, let them make the decisions that they need to make, and encourage them for all the treatments that they have accepted and that have helped them. And choice, giving them the choice to choose whether they want to continue with their treatments or whether they would like to be done and go on with whatever circumstances that they would face next. Here is a PTSD screen. This is just a small screen, almost like a mini mental. The directions are, during your lifetime, have you experienced a frightening, appalling, or something so disturbing that in the past month you would have had bad dreams about the experience or thought about it at a time when you did not want to think about it, attempted to forget about it, or avoided places and circumstances that recreated the occurrence? Are you constantly feeling on edge? Have you felt distance from family, friends, interests, or your home? I have handed a handout out. It's a direct sample from Roswell Park Cancer Institute on a PTSD interview. Interventions. First of all, for an intervention, make sure that there is a multidisciplinary action so that all the professionals are aware of the PTSD and trauma in the SMI individual's life. So, for example, cancer doctors should be aware of the PTSD as well as the general doctor, as well as the nurse, as well as the social worker and nurses. Everyone that's involved should be aware of what's going on in that person's life. Interventions or cognitive behavior therapy seem to be one of the better interventions. Either cognitive therapy or exposure therapy are suggested for PTSD. And also EMDR, the eye movement desensitization and reprocessing, is another one that has been recommended for PTSD patients. Here are some websites that have some valuable information on PTSD and ways to treat it. Here are my references. I hope you enjoyed my presentation. Thank you.